Good now. Good morning, everyone. Welcome to today's live session. Today, we are going to discuss about what I wish I knew before choosing my clinic. I am Priyadarshini, clinical psychologist. Now, I'm going to raise a poll to have a better understanding as to in what point of fertility treatment everyone are in. So, today's webinar session is going to be different, raw, honest, all about asking right questions before starting IVF treatment. IVF Pulse is building India's most transparent, tech powered fertility clinic where patients get clarity before they commit to any kind of treatment. IVF Pulse believes the treatment shouldn't be confusing, rushed, or sales driven. Rather, it should be more transparent. That's why we are hosting today's session. I request everyone to please poll in. people who have joined now, please start polling. It will help us in better understanding as to in which point of fertility treatment are you in, and we will get an understanding what are you looking for. And we will start our webinar in 1 minute, next 1 minute. Let's start our webinar. Today's guest speaker is Dr. Ashalatha. She is one of the most experienced IVF experts in Bangalore with 2000 plus deliveries. She believes in informed decisions rather than just procedures. Good morning, ma'am.
Morning, Priya.
Good morning, ma'am. Let's start our webinar today. Ma'am, I would like to know why choosing clinics based just on pricing is a bad or a wrong decision, ma'am.
Sure. Good morning, everyone. I am Dr. Ashalatha, founder director of Wellspring Fertility Clinic. Yeah, this thing has been now commonly seen. This cheaper packages like IVF package only for this much, only for 70,000, 1 lakh, whatever that package is. Really don't know what all is included in the package. Only after you take this package, start your treatment, you get surprises whether medications are included or freezing charges are included, OT charges, etc. etc. There are so many things. So you'll have to understand before you start like what all actually is included in this package, because once you get to know in between your treatment, okay, this is additional, that is additional, one more thing extra, definitely emotionally it is quite stressful, and also it will have a impact on the success rate also. If the journey becomes very emotionally, ups and downs are there, definitely it will affect our success rates also. So it is better to understand upfront what all is included, what is excluded in the packages the clinics are offering.
Ma'am, when you were talking about success rate, there's another question that rises because most of the IVF clinics boast that they have 90% success rate. What should couple really look at, ma'am?
Yeah, that is like really sad when the clinics say 90% success. Definitely it's a lie, because even in Bon Hall Clinic, England, where first IVF or ICSI was started, even there they don't have 90% success. Yeah, success depends again what you're talking about, what the clinic is talking about, whether it's just a pregnancy rate. Okay, even in that it can be biochemical pregnancy, and then there can be miscarriages in between. What is the life take home baby rate? That is what actually matters for the clinic. So couple should try to know about that. And also, like when they talk about this 90%, there are so many things that are involved in this. Okay, patient profile, egg reserve of the patient, semen parameters, all this, which each of these parameters, the success rate again differs. So patient should ideally know for their profile what is the success they can expect. That is the thing they should ask and know and be prepared for that. And definitely 90% is not there in any of the clinics.
I agree, ma'am. I think that is something that all the patient should know before they choose their clinic.
What to
And
expect?
in most of the yes, yes, ma'am. In most of the clinics, the labs are hidden. Why is lab quality so crucial? Because you were talking about the embryo quality and all. So Why is it crucial, and how it does it affect the success rate, ma'am?
Yeah. So, IVF lab is where the baby's journey begins, actually. From the egg sperm together will become an embryo, and from there it is cultured in the lab for 5 days. Okay. So the clean room conditions, the culture conditions, which incubator, there are so many types again, like the tri-gas, box type, bench type. There are multiple things. Control of temperature, and then humidity control, VOCs, that is volatile organic compounds. All these things matter for the blastocyst formation rate and the quality of the embryos, and also the embryologist who is working in the lab full time. There are certain things which need to be seen or examined at certain time itself when the embryo is growing. So only with help of in-house embryologist available all the time this will be possible. So it's not just the doctor always. Even if it is an excellent clinician, if there is no lab support, proper lab culture, condition, everything, clinician can't do much. So it is both 50% and lab 50%. Together we can give a good success.
Okay, that was informative, ma'am. So, with regards to when the patients
Yes, Priya, did you
hello.
ask something I was not able to hear?
Okay, ma'am. I just wanted to know when patient starts their treatment journey, what is that they have to expect in terms of doctor's accessibility? Like how frequently they will meet the
Yes.
doctor,
I think
the
once the treatment
availability.
starts, you mean about the stimulation, if I'm correct. Definitely, there are so many things that keeps changing. Average of 10 days to 12 days of injections are required for the patients. Every day they have to walk in. We prefer patient walking into the clinic to take injections rather than taking at home because of the cold chain and everything. So traveling all the way itself is stressful, and also the changes, body changes, hormonal doses, scans, and we see every day there are certain changes where patient definitely will be apprehensive. In between there may be their friends talking to them and saying, okay, this happened with me, and also thanks to Google to provide all the information and make them more apprehensive. They may have a lot of questions. With the body changes there will be uneasiness. There are certain side effects also of these injections. Not exactly side effects, I would rather say changes like nausea, vomiting because of the high estrogen levels. So all these things they would definitely require to speak to the doctor very often, and I believe in that. So I am always readily available talking to the patient if it is comfortable. And also again, see, the when the stress sets in, even our success and the egg quality, embryo quality, everything will matter. So doctor should be personally available throughout this journey, I feel.
I agree with you, ma'am, because as you tell, I understand it is going to be a rough ups and downs phase, and definitely an expert's hand holding is very important. Ma'am, that what is the duration? Because mostly we hear that IVF process is just 2 weeks process. Is it really, or is there a timeline, ma'am, for IVF treatment process?
This 2 weeks process, what people talk about is from the start of injection. As I mentioned already, 10 to 12 days of injection, then we retrieve the egg, and then for 5 days, embryos are cultured, either frozen or transferred. This takes approximately 2 weeks. But treatment is not just this. Before this, definitely there is a preparation time required. Patient walks in, we can't say, okay, come, we'll start IVF today. No, it doesn't work like that. See, because all these patients who are unable to conceive already stress their oocyte quality, semen quality, everything is compromised. So, and to be precise, the oocyte which is going to release or we are going to retrieve starts its journey 85 days before. So, unless we give this pre treatment with some antioxidants to improve the quality of this eggs, it doesn't work. This is the physiological time. This what I'm saying 85 days for the egg and 72 days for the sperm. This much of time we have to give for the oocyte or the sperm to improve the quality so that it can become better, fertilize, and give us a good quality embryo. This is one part. And again, after that, there may be certain hormonal disturbances in that particular patient, maybe prolactin levels, maybe thyroid levels, so many motility or morphology. All this also needs to be addressed, which also takes couple of weeks or maybe a month's time or maybe 2 months. We have to see, it is all individualized. And okay, once we have the embryos, after the embryos, see, now most of it, 90% of the cases, we freeze the embryos and transfer it in the consecutive cycle. There again, before we do the embryo transfer, we have to do a mock transfer and see if uterus is easily negotiable. And also during this preparation of the uterus, we are looking at certain amount of thickness, the blood flow, and the progesterone levels, which we may not achieve in the immediate next cycle. It may take 1 or 2 cycles, or there may be some issues in the uterus which we may have to address with a hysteroscopy. So that will take another one cycle. Unfortunately, one cycle is for 30 days. So it is again individualized. For some couple, it may just be about one cycle preparation, one cycle the stimulation and egg retrieval, and next cycle the transfer. But there are couples where we had to take 6 months, 4 months, 5 months. It is again individually. Each patient's profile is important to know how long they would require to complete the whole cycle to conceive.
Okay, that was a great amount of understanding, ma'am. You were talking about there are different lines. Couple who usually come and they wanted to suddenly start IVF treatment. Prior to start of treatment, is a body preparation required, ma'am?
Yeah, like just now I mentioned, that's a good question. As soon as the patient comes, we should not rush them for IVF. First, we need to understand what emotional things they are going through, and also the hormonal changes or disturbances that is there in that particular patient. Also, like um, like I said, their sleep pattern, their lifestyle pattern, everything we need to understand. And then only, definitely, like I said, to improve the equality, certain uh, amount of supplements, vitamins are required. And then only we should go for IVF per se.
So, talking about IVF, ma'am, in that case, do all the couples who walk into clinic need an IVF treatment, or how do you take it, ma'am?
Not all the couples need IVF. See, IVF, like they, when couples come for infertility treatment, we have three options basically. First one is timed intercourse, second is intrauterine insemination, and the last and the third one is IVF. So, if the patient's egg reserve is good enough, patient is young, then definitely we can try the first and the second option. We have to try, not we have to try and go step by step. And then, yeah, if that two options are not working, then IVF is there. Of course, IVF from the clinic point of view, IVF is more lucrative and more, and also it has more success rate compared to first two options. But definitely when it is possible with the research and the age on the lower side, we have to try first two options. And only thing is when there are, both the tubes are blocked, that is again one important factor to consider IVF. If both the tubes are blocked, then first and second option doesn't work, then IVF becomes the only option. So, like this, ovulation induction, timed intercourse, and IUI are definitely available, though success rate is less. We have to try these two and then go for IVF.
Ma'am, uh, when we are talking about IVF, why of the couples assume that IVF is the first step towards the parenting journey?
Yeah. This assumption mostly because of this Google or the marketing strategies, what the clinics use, or that is what they hear from the others. Probably it is because of that they feel okay, IVF is the only option. But it is not true. Like I mentioned, there are other options also which they have to try, and there is good number of success with that. And like so many of them conceive even with uh, like not even going till the ovulation induction. So many times I have seen one couple 13 years of infertility with hypertension and diabetes and everything, just with supplements, vitamin E and D, they have conceived.
Okay. Ma'am, taking that part, most of the couples who come into clinic, they are told you're running out of time.
Yes. Yeah.
Is it true, or when is it a fear-based marketing, ma'am?
Yeah. See, this also is true to certain population of the patient couple, like where the age is like beyond 37, or even if the patient is younger, the egg reserve is poor, as in the AMH level is less than 1 or something. Definitely, there should be a rush. Patient has to do IVF ASAP, and also in patients who've been diagnosed with certain cancers or something, like where they have to start chemo or radiation, or they have to undergo any surgery where they have to do immediate egg freezing, then we don't even wait for a week or a day. Patient comes today, we start stimulation tomorrow. These are the cases where we need to really rush. But having said that, even in poor reserve patient, it is not they come today and we do it tomorrow. There also we prepare so very for a shorter period, and IVF should be first option for these kind of couples.
Ma'am, there are some couples who walk in and they'll be like, we are still deciding.
Yeah.
And when they look back, what is the thing that they most regret?
So I think that's what the evaluation has not been done proper. Maybe the AMH or so many hormones are there, related things have not been done, and their body was not prepared well enough for taking this IVF. Not enough research has been done by them also. All these things, maybe we didn't have the clarity or we didn't know what was going to happen. We were not ready for it emotionally, like that. So all these things, maybe they feel that they could have done it better, better clinic, better pricing. They, like when you're doing in that field, you get to hear so many of these things from your friends, relatives, everything.
Ma'am, with so many years of experience, can you please come up? What is the six most questions that couples ask you when they have to choose an IVF treatment or an IVF clinic?
Yeah, first, then this pricing, when they say what includes, what excludes, should be understood very clearly, each and every small things. Okay. And then the success rate, especially with respect to the patient's profile, particular patient's profile, and also the lab part. What are the equipments, whether full-time embryologists are there, etc., etc. In-house lab is there, and also throughout this treatment, well, I have access to the doctor. Will I be able to approach the doctor, clear my questions or any apprehensions? And for in my case, what is the time I can expect to finish the treatment, conceive, and probably deliver everything? And how can I prepare for this treatment? What is the preparation required from my side? What do I expect, etc.? These things, I think they should be like clear before starting, and they do ask these kind of things.
Okay. So it is mostly about first thing the doctor, the second thing about the lab, and third thing about the pricing and how to go about with the treatment.
Yes,
Is it, ma'am?
yes,
Okay.
definitely.
Um, okay. So, ma'am, thank you for your clarity and walking us through how to choose an IVF clinic or a fertility clinic. Uh,
I know we
ma'am,
have covered a lot of issue today, and whoever is attended may be feeling like anxious or overwhelmed, which is understandable. But the good thing is, whatever we spoke today, transparency, pricing, lab quality, having the doctor's access and the timelines to understand and the preparation, everything exactly is what we are doing at IVF Pulse with Wellspring Fertility Clinic. So it's not just ideas, it is happening here. We are following it at our clinic, and we don't believe in rushing the couples, or selling the packages. We focus on a personalized care through all the state of the art technology and also a good embryology team.
uh, thank you, ma'am. Thank you for walking us through the lab quality to body preparation to rushed decisions. We will take up questions from our audience, ma'am. Now we have um, Mr. Manoj who's asking, is it possible to track IVF digitally?
Track?
IVF treatment digitally.
Yeah, I think IVF Pulse is all about that, whatever is happening from the patient's, profile, demographic profile to the end where embryos are transferred through the pregnancy, everything can be tracked digitally.
So I'm taking a next question, ma'am.
Yeah.
Uh, so there is this uh, person who was asked. There was a chain of clinic that he had visited. So he is like they told to take IVF directly without doing any further assessment. So what is your take, ma'am? Is it correct or is it wrong? Because he tells his wife was having PCOD and thyroid issues.
Yeah. See, for just PCO and thyroid issues, there is no need to rush for IVF immediately. Yes, as long as if both the tubes were blocked, then IVF is the only option, like I had said. But if her age is like less than 35, definitely first two option what I mentioned, timed intercourse and also intrauterine insemination should have been tried.
Then she has multiple fibroids and uterine polyp. In that case, will her IVF become successful? And what is the success rate that she can expect?
Multiple uterine fibroid, again, it depends what are the sizes of those fibroid, what type of fibroid, where exactly it is located, whether we need to remove those fibroids. Maybe it is coming in the way of the cavity where the baby is going to sit. Not only it may prevent the implantation, or if it allows the baby to sit or implant, then maybe it will not allow it to grow. So we need to see all these things plus her age, then only we can give her what success she can expect. Just having a fibroid which is subserous, which is far away from the cavity, will not at all affect her results or the IVF pregnancy. But yeah, if a small, even a small as 1 centimeter, which is submucous and which is coming in the way of uterine cavity, it will not allow the baby to implant. It is like that. So we need to understand the type, the size, and the location to tell exactly what is the success.
Okay, ma'am. Thank you, ma'am. And there's this gentleman who's 32 years old.
Yeah.
His sperm count is 10 lakh. So is IUI possible with the count is what he wants to know.
With this, we do something called semen processing. So with that, we select the best quality motile sperms. Definitely, there is a possibility, though success rate may not be as high as 20%. With less chance, there is a possibility to do IUI and try. And we also need to know the motility and morphology, not just the count. This count, IUI definitely can be tried.
Okay. So he also wants to know what is the minimum good quality of sperms with motility is required for IVF, I mean IUI procedure.
See, three basic parameters we see in the sperm. So, one is 20 million count in 1 ml of semen. This is about the count. 50% of this 20 million has to be motile. When I say motile, it is forward movement or the progressive movement. Sperm has to move from one place to another place. That moment, 50%. And then 4% morphology. That is, sperm has a definite shape. It has a head, it has a neck, it has a tail. So these forms should be normal, minimum 4%. If these three parameters are, that is what we see basically. If it is good, then we can do IUI with and expect 20% success rate. That's the maximum chance we have with IUI.
Okay, ma'am. So there's another question. She tells her AMH is 1.2, ma'am. And is there any treatment to increase AMH levels?
The treatments to increase AMH is not sure, because these are empirical and also this is not reversible. So with DHEAs, we expect AMH to increase. It is not from 1.2, maybe 1.3, 1.4. We can't expect it to become 2 with any kind of treatment available so far. Okay. So, what the treatment basically does, what we have today, it will hold on the AMH for certain time at that level, and it won't allow it to decline faster, because once the AMH starts declining, the rate of decline is much fast. So this can be avoided through these DHAs currently what is available. There is nothing such that where we can drastically improve the AMH from 1.2 to 2 or something. It is
Okay.
not reversible, unfortunately.
Okay. Ma'am, there's another question. She is 46 years old,
Mm.
and she wants to know at that age what is the success rate of IVF if she undergoes the treatment.
So, success rate is definitely poor at this age. And also, I need to know about her AMH level. What is her AMH level? And also antral follicle count, which is possible only by a scan on day 5. So, if the AMH is like between 1 to 2 or something, we can expect a success rate of 20 to 25%.
Okay.
But if
So,
AMH less than that, then success rate again will be poor.
okay, ma'am. So, the same person who was talking about our AMH being, can the oocyte quality be enhanced? She wants to know, ma'am.
Definitely, it can be enhanced to all the antioxidants, and there are certain new molecules which we are seeing very positive results. There are certain supplements which we can give and improve the oocyte quality. Again, if the AMH is above 1, where AMH is less than 1, we cannot really improve because the number of eggs are less. Already the egg reserve is depleted. Generally, the good quality eggs are released in early part of the reproductive life. So it depends again on the age quality. If it is just a PCO cases where we have so many number of poor quality eggs, in those cases definitely we can improve the egg quality.
Thank you, ma'am. And there is another person who's asking, she is already taking IVF treatment. Her
Mhm.
embryos are frozen and she has grade 2 embryos. What
Mhm.
could be the success rate of grade 2 embryos if she transfers?
Embryo has this unique quality of correcting certain abnormalities. That is why grade 1 and grade 2 embryos are transferred. Yeah, when you compare grade 1, maybe in grade 1 you have 60 to 70% chances of pregnancy. With grade 2 you have 50 to 60% of chances. It is not very significantly different. Again, uterine lining, everything also contributes.
Okay, ma'am. So there's another question wherein she is having high levels of prolactin. Would
Mhm.
prolactin impact fertility? Is what they want to know.
Definitely, prolactin affects the oocyte quality. Okay, so it again, prolactin is what levels we have to see. If it is above 200 and all, there could be some pituitary adenomas, that is a small tumor kind of thing in the pituitary gland. If it is less than 200, it is basically due to stress factor. Okay, or if the patient is hypothyroid, that also can increase the prolactin levels. It has direct effect on the oocyte quality. However, it can be treated. If it is less than 200 only due to stress factor, we can give medication to bring the prolactin level down and then start stimulation or ovulation induction.
So I'm waiting for the next question, ma'am. Before next question pop up, usually people go about with this IVF clinic shopping to compare prices.
Yeah.
So, what is your take on that, ma'am? How how many shopping is good? Because I we have come up people who have gone to almost all. They name all the IVF clinics available. So, at what point people should stop here, really consider treatment, ma'am?
See, like I said, the packages and their success rate and the team who is there. So I think when they talk, when they have counsels, they can understand. And now after attending this webinar, at least they know what to ask and understand whether what they are hearing is what they can expect. Same thing what they are telling there, and the expected timeline and whatever their profile is, whether they are talking same thing, approachable. I think all these factors, I don't know how many clinics they have to go. I really can't say. They may just find a good clinic if, especially if they come to ours in the first this itself. But if they are walking to the wrong clinics, maybe they may have to go to three, four clinics. I don't know. I'm not sure how many to say.
Ma'am, there's another question. Wherein our natural lining was 7 mm, uterine lining was 7 mm thickness. After stimulation, it is still 7 mm. So, is this thickness good for getting pregnant? Is what our question is.
Normally, to decide for an embryo transfer, in frozen embryo transfer cycles, I'm talking about, we
Okay.
expect minimum of 8 millimeters, a maximum of 13 millimeters. So, but consistently, when we are not able to get that kind of lining, it is only 7 millimeter, provided progesterone levels are okay and the blood flow to that lining is also okay. So, after two cycles, we are not able to get, or after two cycles of preparation, I meant, we are not able to get 8 millimeter, then definitely we can transfer for 7 and we have got pregnancy even for 6.5 millimeters also. It's not only the thickness and other factors also.
There's another question here, ma'am. Wherein wife is 34 years, husband is 35 years. They have been trying for pregnancy from last 3 years. She is having mild endometriosis and she underwent laparoscopy. So they have tried 2 cycles of IUI in last 6 months. And with uh, last two IUI semen analysis, husband's sperm morphology is dropped less than 4%. And her AMH level is 2.16. She's asking, should we go for an IVF now?
2.1 AMH is good enough from egg number and quality point of view, but morphology less than 4% needs to be worked on. If morphology is poor, generally we go and check the DFI, that is the DNA fragmentation index of the sperm. See, the basically the job of the sperm is to give the DNA material to the baby. So all this DNA or the genes is tightly packed. When morphology is poor, this gene or the DNA material is generally, we see it is fragmented. If the fragmentation is very high, then we need to wait and treat for 1 or 2 months and then go for IVF.
Okay, ma'am. So this will be our last question. In audience, if you want to ask any more questions, please fill in our form and Dr. Ashalatha will be available for free consultation at a center, and the consultation will be face-to-face consultation. Uh, so ma'am could personally go through your reports and give the exact treatment plan, what is required. Thank you, ma'am. Thank you for your time and enlightening us with regards to how to choose a fertility clinic. And so, thank you, ma'am.
Thank you. My pleasure.
So, thank you. Thank you for attending our live webinar. I hope it was very informative for your treatment journey. And please follow us on Instagram. We have shared the link with you. Thank you for attending today's webinar.
Hi all, please fill the form consultation. In case if you are not able to get access, please let me know. All webinar attendees are eligible for a free consultation with Dr. Ashalatha. We will schedule appointment. Malika Gupta, our team will personally get in touch with you, and as per your time convenient and Dr. Ashalatha's time convenient, we will schedule your appointment. Catherine, yes, please share your reports. You can get a second opinion. And I am also sharing our community link here. Or if you are already in our community, please feel free to ask your questions over there also. Dr. Ashalatha will answer them. WhatsApp group is very active. Our Instagram is very active. Please fill the form. Yes, you can speak on our WhatsApp group. Dr. Ashalatha at the sharing the WhatsApp group link here also. Yes, Sapna, I am sharing the link. I will schedule your appointment. Please fill our form. Please share the link also here. I am sharing the WhatsApp link also there. Sana, I'm sharing our website link for you to get more information on the doctor and on the clinic. Please fill the form. I can see the responses have started coming in. Whoever fills the form will be eligible for a free consultation, or you can ask in our group also. I am sharing the chat link here. I've shared the form link, I've shared our website link, plus I've shared the chat link also. I'm sharing the form link in the group as well. Sapna, if you are still here, can you please fill the form, or can you put your questions in the group? Team will personally get in touch with you. Ramesh, Sahana, please fill the form. Sapna, we've received your details. With you. Thank you. We'll keep this link open for another 5 more minutes. Please fill your form, or you can also put your queries in the group. You can also put your queries in the WhatsApp group. Dr. Ashalatha will be answering them there also. Thank you, Sahana. We've received your form. Our team will get in touch with you. Thank you, Ramesh. We've received your form. Our team will get in touch with you. Yes, Vasudev. Location in Bangalore is Kalyan Nagar. We have a clinic in Kalyan Nagar. We do have a clinic near Hoskote also, Ramesh, in Whitefield, Hoskote. We will share all the details once we get in touch with you. This link is available for 4 more minutes. That you can post your questions on our WhatsApp group. The form will be live for 24 hours. I hope you all have filled the form. I will end this call and you all can put in your doubts and questions in the WhatsApp group. Plus, the form will be active for another 24 hours. Please fill in the form and get your free consultation. Thank you, everyone. Thank you for joining our webinar.